When a cigarette is lit, more than 7,000 chemicals are released, which is why smoking is one of the leading preventable causes of death worldwide. Despite this scientifically proven fact, billions of people still smoke. When a person stops smoking, their blood pressure and heart rate return to normal within the first 20 minutes, as the nicotine in cigarettes releases chemicals that increase heart rate and narrow blood vessels. This can cause cold extremities, but they return to normal temperature after some time. Within 5 hours of quitting, nicotine cravings begin, causing mood swings, drowsiness, tense feelings, and difficulty sleeping, as nicotine also releases more dopamine than normal. This is a typical physiological response to the decrease in nicotine release. After 10 hours of quitting, the inhaled carbon monoxide clears, allowing oxygen levels in the bloodstream to return to normal. This is because carbon monoxide and oxygen compete to bind to hemoglobin in the blood. When carbon monoxide clears, more room is available for oxygen. However, chronic smokers may have larger red blood cells, causing the blood to become thicker, leading to higher blood pressure and increased chances of blood clotting. After 1 day of quitting, coughing increases as the body begins to clear toxins from the lungs. The risk of developing coronary artery diseases decreases at this point. After 2 days, all nicotine and its metabolites are eliminated from the body, and damaged nerve endings start to regrow. In chronic smokers, tar and other chemicals in cigarettes leave fewer taste buds that are flatter and have fewer blood vessels. After 3 days, nicotine withdrawal symptoms peak, causing headaches, nausea, cramps, anxiety, and depression, as is typical for most addictive substances. After 30 days of quitting smoking, the risk of developing type 2 diabetes, cancer, and cardiovascular diseases has already decreased. In 3 to 9 months, the cilia in the lungs, hair-like structures that help sweep away dust and debris, are almost fully repaired, and symptoms such as coughing and shortness of breath are almost completely eliminated. After a whole year, the risk of heart disease due to the formation of fatty deposits on deteriorating arterial walls decreases by almost 1/2, and in 10 years, the chance of developing lung cancer decreases to half of someone who has not quit smoking. In 15 years, the risk of heart attack decreases to the same as someone who has never smoked in their entire life. However, the extent of damage to the lungs and the risk of developing lung diseases may vary depending on the average amount of smoking per day or year, and some irreversible damage to the lungs may occur. Although quitting smoking may be difficult, the benefits greatly outweigh the initial withdrawal symptoms. And always remember, with every cigarette you smoke, you take a step closer to sack a